Good afternoon, everyone. Welcome to the Juneteenth Foundation's Career Fair focused on healthcare. My name is David Washington, and I will be the moderator for this afternoon session. We have several folks who've joined us today to provide some insight on the industry. We have Howard Mosley and Giselle Jones, and they are coming to us live from Atlanta, Georgia, to give us some insight on activism, policy, industry, careers, all of the above. So please don't hesitate in asking questions of this forum. And we look to hopefully enlighten you and inspire you so that you can go out there and be productive as we celebrate Juneteenth and add to the contributions that our folks have done for so many years. Howard, I'd like you to take the floor first and introduce yourself and give us some sense of your background and provide some insight for us today.
So we're HEAL Collaborative. We're a small nonprofit that looks to change the health equity gap. And we're looking to work with churches or the faith community to help close that gap. I've spent, again, for those of you that didn't hear, I spent about 16 years in the Georgia legislature, and I spent over 2.5 decades working in the safety net institution, seeing health policy made and health policy implemented, and understand really how that gap gets put into being because of this lack of trust or mistrust in the healthcare system. Working in healthcare has been a blessing for me in my life. It has given me an insight into how communities actually function, that there are many different determinants that go into how communities are healthy and thriving. And there are many things that are lacking from a policy standpoint, many things that are lacking from a funding standpoint, many things that are lacking from a knowledge standpoint in communities of color that creates issues specifically around healthcare access that create this health equity gap. And we just want to do what we can to cover that health equity gap. And I just want to use my expertise, my knowledge base, anything that I can do to bring to our communities to make it better. And so that's a little bit about me. And I feel like I've explained this 6 times, but that's okay.
No, thank you, Howard. Gabriele, please enlighten us on your background and what you'd like to bring to the forum today.
Absolutely. Good afternoon, everyone. My name is Gabriele Jones, and I'm the lead community outreach and advocacy engagement director for HEAL Collaborative. And I work with a team of people like myself at HEAL, who our direct responsibilities are engaging with different stakeholders around the country when we bring these initiatives to the faith community. So when we think about influencers or key people in the communities of color, starting with the church and building that out. So it would be doctors, nurses, community leaders, civic organizations, advocacy groups, to bring that knowledge and expertise into the faith community at the community level. My background, over 30 years in the medical device and pharmaceutical industry doing advocacy engagement. So over those years, when I was working for the medical device industry at that time, going back 30 years, is when we think about innovation and FDA having the responsibility of driving or driving innovation, but we were not seeing the progress when it comes to medical devices. And at that time, FDA, we were looking to how do we streamline the review process to get medical technology on the market. So my role with HEMA, which is now AVAMed, which is the advocacy organization in Washington, D.C., was to go out and talk with specialists, mainly providers, like orthopedic doctors, cardiologists, and asking them, what are the needs for your patients? So they understood that technology could not be stifled. We really needed to address some of these issues. So my work was really flying them into Washington, D.C., and getting them to testify before Congress about how there needed to be change so that we could further innovation. And in 1997, the FDA Modernization Act was passed, and it was due in part to a lot of these advocacy groups that were coming there and giving testimony about the importance of that. So I moved on from there to pharma, pretty much doing the same type of work, advocacy engagement with traditional and non-traditional organizations, people that really had a voice at the community level in terms of what does access to healthcare and treatments look like from the patient perspective and the provider perspective. And so I brought that knowledge and insight, which I love doing, engaging with at the community level to heal, and currently doing that type of work.
That's awesome. And just to give you some background for myself, I've been in the healthcare industry over the past 25 years from a technology perspective, similar to Gabriele, and I've dealt with hospital systems within a same city that have horrible care to have tremendous care, from New York and all throughout the country. So you see these disparities. And that brings me to my first question that I'd like for both of you to really expound on. And Howard, I'd start with you first, because you'd have to be under a rock to not know what healthcare has meant to this country for the last 16 years, starting with President Obama. And this thing really gets under my skin, especially within our community, when people say, he didn't do anything for us. And I said, what more could he have done for you than to make sure your healthcare was sound? Because without that, you have no future. You know the statistics prior to Obamacare. We were the hardest hit with diagnostic services and our longevity and our treatment and all those things. And the Obamacare policy really put funding and focus on our communities in a very large way. So what I would like for you to share with me is, where did you see it before and now, and where do those opportunities still exist for us to improve it and provide more policy improvements, and how would that also impact career fields that you've seen? So just give us your view on how the Obamacare era brought in a whole different focus with respect to African Americans in our community.
All right, so great question. You do know that we're in Georgia, so I put that out there. And you know that for some reason they didn't think President Obama was American. But anyway, we're not going to talk about that. That's another program we can do together. But you know, the Affordable Care Act really tried to bridge the gap between the federal poverty guideline, 100% of federal poverty guideline, to what Medicaid would pick up, and it picked up a substantial number of individuals being able to have access to the healthcare exchanges. The way that the law was written around the individual mandate, actually in ensuring that these individuals get access to this healthcare, was huge. Under the Trump administration, when they went through dismantling pieces of the Affordable Care Act, specifically taking away the individual mandate, I think some states and some healthcare systems began rolling back some of those advances. And what we saw in the Supreme Court ruling just recently, in that rollback of the individual mandate actually caught them in a place where the Affordable Care Act now is the law of the land. So what it did cover quite a few people that were not covered prior to the Affordable Care Act passing in 2010. So we saw in the healthcare delivery system that those hospital systems were being supported by this new source of revenue that was coming through. Healthcare, and this is, I want to say two things here. One, healthcare is one of the biggest economic drivers in a community. You lose a hospital, you lose practically billions of dollars worth of economic input into that community. And a lot of these rural communities live and die by their hospitals, and a lot of their legislators seemingly don't understand that. And so they support policies that don't support those rural hospitals getting into place. They want to go after things like tax credits, those things that may trickle down in terms of dollars, but not a direct dollar input, number one. Number two, to your statement about the community, our community, saying that President Obama didn't do anything, really speaks to this lack that we have in our community about the political process. And passing a law is no easy thing. And I want people to understand that introducing a bill and getting it through either Congress or a state legislature is not a cakewalk. Just because you introduce a bill doesn't mean that it's going to go anywhere. And so for him to move a piece of legislation as the first African-American president, number one, through Congress, number two, that has survived Supreme Court challenges, number three, is huge.
Yes.
And people need to recognize that.
3 Supreme Court challenges with a Republican Chief Justice being ironically one of the biggest advocates to save the program, and Justice Roberts. So that means that that legislation was profound in touching all Americans.
Amen. Amen. And I wish that we would do more in educating our community around how to navigate the political system.
Yes.
And one of the things that we do in our organization is work with churches to do that. But there is this big gap in how policy is made, and everything that we do in our society, nobody makes policy in America except elected officials. And until we get engaged in the process, we're going to always find ourselves behind the 8 ball.
So Howard, take it to the next step, because you did a very good job of bringing the Affordable Care Act, kind of give a comprehensive overview, and then you took it to the churches, and you getting into now some of the advocacy and education that goes there. Speak to that advocacy, education, engagement, and also career pathways. How does all of that come together from where you are?
Well, so I'm glad Gabriele is here because she can really speak to a lot of this. So currently, to give you an example, currently we're working with the National Baptist Convention out of Nashville to help bring educational programs to the Baptist churches across America. Reverend Alvin Love, who is the leader of the faith initiatives, has been huge in trying to ensure that the church population understands how politics and healthcare, that intersection, that this separation of church and state doesn't mean that you don't get involved in politics.
Mm-hmm.
And so that will help drive health policy in our communities if the church actually gets actively involved in that space. Where I see from a career standpoint, there are individuals who are in the healthcare space that can give back to our communities and not keep this knowledge to themselves. So people like doctors, social workers, case managers, nurses, actually, so just about everybody in the Black community goes to somebody's church, or their mama goes to somebody's church, and then being able to take those talents back into that environment to help make our community better. The better that the church can advocate, specifically in the healthcare arena, the more jobs can be created in communities of color. Now, if you look around in most communities of color in the United States, in these major cities where we exist, you generally don't find hospitals.
No.
And that says something by itself. Back in the day, when our parents and our grandparents were coming up, hospitals existed in our communities.
Mm-hmm.
Today, they don't. And so we need to try to figure out, not only in bringing African Americans or people of color into the healthcare career space, but how to bring those assets back into our community.
I think you hit, and before we go to Gabriele, I think you're hitting on something that's very timely in this last year and a half that we've been experiencing COVID, because especially with President Biden coming on and doing the distribution, they've had to rethink how they touch our community. And a lot of the wholesale programs that they were thinking of weren't quite working, and they had to get closer to barbershops and churches and those type of things, which makes me say, okay, we've got our nonprofits. Why don't we use that now as an opportunity to expand and have a healthcare arm of our nonprofits? And so that we bring that whole community together, use our professionals in that space, and allow them to have more regular contact with the community in the absence of those hospitals. Let's do better health programs, health initiatives, so that we keep the community healthy. I mean, it sounds like a cliche, but you see now these outlets are being used to administer vaccines, right? So there's a plethora of Black nurses and doctors and paraprofessionals that have been deputized to do this work. So why not capture those people that we have now in our community and use them to a bigger benefit moving forward? So Gabriele, you tell us a little bit about your thoughts on that space and how you see some of that maybe come into play.
Sure. So when I think about advocacy in our communities, those of us that are in the healthcare space, we understand healthcare issues and the policy component, but our communities don't understand it because we've never been at the table. We're not informed and we're not engaged because that information does not come down to the community level. We use this phrase, going beyond the ballot box. We vote, and there are a lot of organizations, when it comes time for us to vote, we come out and vote, and then we stop. We do not engage on local issues that are impacting our communities. So if you look at social determinants of health, we cannot look at health in silos. You cannot look at health without addressing transportation, food deserts, uninsured, underinsured, jobs, employment. All of these issues are part of people being healthy. And HEAL Collaborative is, like Howard said, it's in our name: health, education, advocacy, and learning. Also, until we understand the legislative process and do more training of our people, just average people, but also the nurses and doctors that you mentioned should also understand, that look like us, should understand, how do I take the voice of the patients to that policy arena? So when there's legislation that's being debated in our communities at the state level, we all know who our congressmen are. Very few of us know who our state legislators are, or our county. And that's where it really happens. Thus, that's where decisions are being made that directly impact us. So we need to do more training at the community level of how to be advocates for ourselves, how to understand the legislative process. We're right here in Atlanta. The Capitol is right there. We have a short session in the state. You should know how long your sessions are in your state. A lot of people don't. Understand what bills are introduced that impact us. We have to do more of that for our communities so that we are equipped, that we are educated, we are present, and that we can help our state legislators when they need to hear our voices to help move legislation along in that process.
And I want to jump in right quick because we have a comment in the chat about healthy living and teaching individuals about a healthier lifestyle. You know, one of the problems in advocacy organizations that serve our community get just enough money to fail. And because we're not as active in the political process, but people know they need to check off boxes, we don't get enough information. Organizations don't get enough funding, let's say, to be able to really advocate, to make big differences in some of these areas. Because you can't go in and do one program and be gone and expect that there is a learning process that happens on the other side of it. And so we need to make sure that we collectively as a people advocate for these organizations to help support our communities. These organizations that are supporting our communities to continue to do that hard work.
No, you hit on exactly, and I want to thank Stephanie Phillips for that question about, uniting and educating and getting the disparities and out there. I happen to be the chair of board at Bowie State University for an organization called the Maryland Center that was started out of the tobacco settlement years ago, and making sure education came to minority communities, and that's grown. We work very closely with Steny Hoyer in the state of Maryland to make it happen. But what I'm saying is I've learned firsthand as a corporate person focusing on my community, and I view my community wherever I am, regardless if I live in Virginia or Maryland, the African-American community is my community. So that is where I care about. I care about what's going on in Atlanta. I remember how bad years ago Grady Hospital was and all those type of things, and people put out, and you know what I'm saying? So we've got to be aware of wherever we are and the services that we get. And to the point you're making, let's highlight your organization a little bit here. Let's talk about what HEAL is doing. And in light of that, how do you see, I know under the Trump administration, a lot of the grants got cut, a lot of that outreach dollars got cut. What are you seeing happening now? And, how is HEAL able to get that message out there and help folks do what we're talking about right now?
So again, great question. There are organizations that are actually committed to trying to make a difference in this space, and they're willing to put funding in place. HEAL Collaborative has been blessed with the fact that, and we believe that because we're working with the faith community, that we have favor
Mm-hmm.
We'll put a pin in that too. But we've done okay in this space. The problems come in terms of how to deliver consistent, ongoing messaging when it's not sexy, when it's rubber meeting the road, doing the hard work of getting the learning piece to happen. So it's easy to educate, but learning is actually the continual pushing out this information and doing testing of whether or not people have made some got learning out of that particular event and moved on. One of the things that we want to do with our organization is help churches build their muscle to be able to advocate for themselves. And we use our organization to try to help these ministries be more impactful. It's one thing to do a health fair, it's another thing to actually have the expertise in your ministry to help people navigate the health care landscape. And so that's kind of our nuance in what we do to try to ensure that happens. And there are people that would like to fund that, and there are many that are not interested in that, and that's okay. We will continue to trudge along, and we'll make it's save one. We save one today. We go tomorrow, and we'll save another one, and that's the deal. We all have to be committed to saving one.
Let's talk about something. Oh, I'm sorry. Go ahead, Gabriele, please.
And also part of that too is we pull from local influencers to be part of the community. Traditionally, the church has been closed to the outside world, kind of in some communities. And so we look at how can we leverage the knowledge and expertise of not just healthcare leaders. We want influencers like yourself bringing that into the community, into the church community, where we know that everything is being vetted by the leadership of that church. But we want them to see there are resources here and we're not in it. It's not, our relationships are not transactional. They are relational. We want to come back. We want to come back, not checking off a box and moving on. It is about helping them to have sustainability in these health education initiatives and sourcing that out as much as we can.
Yeah, so much with you, what you're saying for me is personal truth. I remember as a kid, moving from the Bronx, New York to Charleston, South Carolina, where my family's home is from. And I graduated and went to high school. And growing up in the church, so much of my youth development and education occurred through church programs, public speaking, community groups. And you're bringing a very interesting perspective, Gabriele, what you just said about not just having health professionals, but influencer. But this could also come together because I ask the church and the ministerial group, from what I recall growing up and even now, has a consultative counseling disposition as well. It can be used for that. And what I'm trying to find out when we talk about healthcare, especially in our community, one of the big taboo topics we don't talk about is mental health. And that mental health plays so much a part in a lot of other things. We've tackled drugs, we've tackled AIDS, we've tackled COVID. But when we look at what's running rampant, whether it's, family planning and adolescent, families, and we're talking about gun violence in Chicago. What are these stresses that we experience in our community? Because I think, again, to Howard's term, we put a pin in it, so many topics. I think we have collective PTSD in our communities because we deal with so many pressures, driving a vehicle while a Black man, walking with a pack of Skittles, whatever, wearing a hoodie. All this comes to healthcare and stress. And so what kind of programs are we doing before things become a true medical issue to just provide stress management, life management, mental health? How do we, I guess I'm going all over the place, but how do we help create an agenda of topics that we can focus on that disparately hurt our community? And I think mental health is one of those that we've not put a lot of focus on. How do we drive dollars to that and help our community and use the structure and platform that you have right now?
Yeah, so great point. Gabriele and I were talking about that before we got on this call about how when we were growing up and when our parents were growing up, things are different. People don't engage in the same ways in our communities the way that they used to. And there is a distinct difference in how communities are organized today, different than they were back when we were coming up. You speak to a lot of issues that unfortunately, to your point, if you take a people that has experienced 400 years of domestic violence,
Right.
and then you set them free on society, the only thing they know is domestic violence, and they continue to perpetrate that. The only entity, in my opinion, I might be a little bit controversial here, is the church is the only entity that can actually step in the middle of this and start the process of bringing, bridging the healing piece of this mental health issue that will make our communities whole. But mental health is a big issue. It is one of the least reimbursed areas in healthcare. People see it as boutique, or at least policymakers see it as boutique. But this is huge. More money should be put into Medicaid programs to help individuals get access to mental health treatment, counseling sessions. Even if you have personal insurance, they'll give you maybe 1, 2, 3 sessions in your insurance package. And after that, you're on your own. Mm-hmm. And mental health issues are not something that you can just sweep under the rug, or you can go take a happy pill or drink a beer or something, whatever the commercials tell you that you do, and then your life is going to be much better. And that's what's happening. These images out here giving people a false sense of hope. But we need to really be more impactful. And as a community, let me just say this. I'm gonna say one other controversial thing, and I'm gonna keep my mouth shut here. We're gonna have to start calling a spade a spade. And in our community, when we mess up, we need to say we messed up, and start holding people in our community accountable. And that was something that happened back in the day that we're not doing a lot of today.
You know, we've got some great feedback coming to us through the chat room, as you noticed before, from Stephanie Phillips. And I wanted to give a couple of points that she's making here on the chat. She wanted to tell us that Healthy Churches 2020, under the leadership of Dr. Pernessa Steele, is a great organization that has stayed true to the course in teaching. And she also talks about Gilead. Yeah, Gilead, and then also agreeing about the conversation with healthcare. I think we're on to something here. Let's talk a little bit about, and she also mentions drug addiction. And that's where I'm saying, because my experience in behavioral health and what I've learned over the years is that a lot of this stuff comes from coping mechanisms, right? Drug addiction and mental health. And that's why I'm saying it's so much at the root of us, because we behave in ways, like you said before, things have been handed down to us, over time. Some of us are able to break the bonds, but it seems like momentarily, situationally. How do we sustain over time? I do want to, since it is a career focus, and this is so much good stuff, because I think when we're talking about these issues, it drives policy, it drives law, it drives, who runs and who's inspired to run for office. But then let's talk a little bit more about the professionals in the space. Okay, just to enlighten those that might be listening, what do you see as, fields that have emerged in healthcare that we have gravitated to as African Americans? And then where do you also see the need still for us in the healthcare space to be a part of in the career field of the healthcare?
Yeah, when I was asked to get on this panel, one of the topics, or one of the concepts that I threw out was, if you can walk into an organization, a Fortune 500 company, and see that the CEO is Black, the COO is Black, the CFO is Black, general counsel is Black, that is something that we don't typically see in large organizations. So we walk in the door, you don't even think about that as a career pathway, because you don't get a chance to see that. Not only that, they don't see, other cultures don't see that, so they don't expect that to see that either. If it is, it's an anomaly, and people think that it's odd in some way, shape, form, or fashion. Now, what's happening in the industry right now is genetic testing, and that's going to be huge. we're going down the path of personalized medicine. So taking your genetic makeup, I can actually determine whether or not ibuprofen versus acetaminophen is better for you.
Mm-hmm.
And our community is going to be behind the 8 ball in this particular arena because we're afraid, or we don't have enough knowledge on our side to understand genetics, to understand how we could benefit from this.
Mm-hmm.
And so healthcare is moving in that space. You being in the IT space, understand and know that robots are huge in healthcare today. Mm-hmm. You won't find surgeons not wanting to go into a body without a robot today.
Oh,
that is huge.
Nanosurgery is already with us. And then, when you talk about that, I'm only going to jump in. I remember years ago when IBM provided, technology to help map the human genome so that we can begin to identify how these genetic traits step out. And in fact, some of that technology was used to assist in the acceleration of COVID vaccine, because when you talk about the application of messenger RNA and how that works. And to your point, I'm not an advocate for the vaccine or not. I took it because I didn't want to be one of those people that look back and say, okay, I could have done it and it's too late and I'm on a ventilator. And I know you got people in our community that are anti-vaxxers or whatever, but science is science and I'll let that be what it is. But the point I'm making is that, one of the things I remember Dr. Fauci, when we were trying to speak to our community, because we're the ones that get hit by this. I remember when this thing first started happening, I would just look at my social media, forget the news, and all the people that I was connected to around the country were speaking to their relatives and who was dying. And I have thousands of friends and lots of African Americans. And I said, guys, pay attention. We don't know how it got here, but it's here. And it's hitting our community. And so one of the things that Fauci did was he highlighted the fact that one of the lead researchers in the cure was an African-American sister. And so we need our researchers. We don't need to run from science. We don't need to run toward conspiracy theories. In our career fields, you can get those STEM programs for our kids so that they aren't afraid by science and those things that we can then bring back, as you said, because that medicine is going to get tailored. And if it's not tailored to our disposition, then we're going to get a variant of somebody else's cure, right? So, there are some things that run in communities in healthcare a little bit more, just like you have Tay-Sachs disease that runs in the Jewish community, you have sickle cell that runs in the African-American community. So we need people putting research and focus on those things so that we can continue to develop. But I'm sorry, I didn't want to hijack your answer. You got me going on that one about the customized medicine.
Well, yeah, that, and then you get into clinical trials, and then you get into some of the other aspects around genetics that our community, and we bring those programs actually to the church so that they can put their hands on it, touch it, as Grandma said, put eyes on it, and so I can feel it, and they can ask questions to scientists right there on the spot. But to your point, you're absolutely right. We need to be a part of the conversation. I was monitoring the chat while you were talking. Not that I wasn't listening to you, but
no, I get you. I'm doing the same thing. So please go for it.
One of the comments talked about fraud investigation. So I'm a certified public accountant, and I have spent, like I said, 2.5 decades in the healthcare space, and I've seen these fraud investigations. There are a lot of people out here trying to game the system. Primarily, though, what I would like to say from a policy standpoint, because there are predators out there, no matter what's going on, and they need to be brought to justice. But there is just not enough money put into these healthcare programs to ensure long-term sustainability and viability for communities of color. And we need to really think through that. But government jobs in terms of managing the Medicaid programs or Medicare programs that help support our communities are huge. And I think that we need more of more people who look like us in those spaces to try to ensure that they understand the nuances in our community to be able to help.
And I'm looking at.
Go ahead. And Tamiko is affirming, and I know you got that from her, her qualifications in that space as well. So go ahead, Gabrielle, share with us what you got.
Yes, there's someone in the chat talking about the nurses. Mm-hmm. I would love to see more specialty nurses. Mm-hmm. It's particularly in the field of diseases, chronic diseases that impact African Americans. Mm-hmm. More cardiac nurses, more oncology nurses. When we look at lung cancer, breast cancer, there are not enough people, there are not enough nurses that are specialized in those areas that can come out into our communities and connect with our communities and be able to relate. Also, if you look at nephrology, directly tied to diabetes, but what are the numbers on that? There are so few nephrologists, Black nephrologists in that field. And we all know that nephrology, that's a for-profit, but we're the ones that are ending up on dialysis.
Right.
And those are for-profit clinics, organizations. But there are very few nephrologists that look like us, let alone those that are in research.
So we've talked so far about, you just hit it, nephrology. We've talked about the nursing. We've talked about the advocacy for fraud. And, you know, when you talk about our elderly community, there's so many of these things are being hit on there. My father is a disabled veteran who we have home health care nurses come to. And to our benefit, we have African-American nurses that work with us, which is a blessing because, you know, some things about us culturally and just physically are a little different, right? You know, our skin tones, our colors, when you're looking at things, you know what you're seeing, you sense them a little differently. And, you know, just that slight thing of, you know, complexion can be a big determinant of the quality of care that you get because people might not look at you the same way. You're not as flushed or you don't have the same, you know, physical characteristics. So I think you're hitting to the heart of the matter, Gabrielle, when you talk about nursing, because nursing is like the front line of so many things. I think that if we could start our own nurse staffing companies, begin to put those things, because I've seen how lucrative that business is firsthand. Okay. And I know that these contracts, they go into prisons, they go into the communities, they go all over in administering this care. And then we talk about fraud. You know, there are those, let's not get it twisted. There's still people who commit crime, but then there are also us who are targeted. And we need to make sure that we have those defense things in place for our community as well. So I do appreciate Tamiko and Stephanie for continuing to add that to us. Let's talk about women in healthcare. And, you know, how has the playing field changed for women from an opportunity standpoint, just in general? What careers have you seen open up for women in the last 20, 30 years, Gabrielle? You know, you're coming to us now where most people wouldn't be aware that women like yourself have been in the advocacy role and have, you know, been helping to shape and form policy outside of the clinical environment. Where are those opportunities for women in the healthcare space today?
I would say in public relations, definitely. In that field, because, you know, if you think about for-profit or a nonprofit, the public relations opportunities out there to have a voice for the organization that you're working with, we're able to create that narrative in terms of messaging getting out to our communities. So I think that's a great area to be in. And definitely across industries like pharmaceutical industry, medical device industry, which like I said, I've spent my career in, is how do we let inside these companies, be a voice inside these companies on what communities of color look like, how to engage appropriately, how to be more impactful and meaningful in the work around not just access to medications, not just access to treatments. How do we look more holistically at communities? How do we look more holistic at the patient perspective? So I think more females in that space, because we can relate more, I think, across the family, across our children. I've got two kids in their mid-30s. So understanding how they are different, how they communicate differently than I do, and how I can support that. But also having that pharmaceutical background that I had starting in this field 30 years ago, and a lot has changed. We were not even considered, African-American organizations were not necessarily considered 30 years ago on issues around healthcare. We just weren't. When I looked at what advocacy groups look like, you had the top ones, American Cancer Society, American Heart Association. Those were the organizations, and they were the spokespeople for our communities, but we were not represented inside those organizations. So we need to get either back into those spaces, and leadership positions at those organizations, and definitely leadership positions at some of these industry partners, whether it's the health plans. I mean, if you're looking at where there needs to be a lot of work done in these big health plans, because that's a driver, that's a cost driver there as well. And getting them to understand it's not necessarily just about coverage, it's about understanding what communities, understanding how communities function. What does coverage look like in those communities, whether it's, I don't know, United Healthcare, some of these other ones out here, and not just be this silo mentality. You have to look at the whole community. So definitely health plans, I think, is important. Definitely pharmaceutical companies, these large advocacy organizations, these traditional advocacy organizations, and be in leadership positions.
And I would like to add one other thing to that: marketing. A lot of the images that are coming to our community are not being directed by people who look like us, and so we need to have people in that space, specifically women. We need to have African Americans or people of color in those spaces that help drive what the image of our community is going to look like and what a healthy community of color looks like. We need more marketing.
So you're a perfect straight man for this next question, Howard. And there are probably two more loaded questions I have before we go. And I know that we're right about 13 minutes or so before our time ends. So let me ask you this one first, because we've kind of talked about the community and the African-American community. But my question is, what is the African-American community more? Because let me set it up this way. Prior to 1910 in this country, 80% of all Blacks lived in the South, right? Mm-hmm. Then you had the great migrations north and west. You had folks from the Mississippi Delta and the Alabamas going up to Chicago, folks from Louisiana going out west to Texas and California and Georgia and the Carolinas going up to Philadelphia and New York. And then this exchange started back and forth. And this stuff happened in my own family for over 100 years. But with that, when we went to these large population centers out of the South, there were concentrated Black communities that had to be self-sufficient, like you talked about, with our own hospitals, our professionals. And then you had a lot of social change after integration. Then you had the fall of some of these economies because of outsourcing and things that go across the factories, and all that went down. Then you got inner city blues. Then we were pushed out, and then gentrification happens. And then those people that are left don't have resources and food deserts and all those types of things. So as we face the issues of today, number one, what is the Black community? Because to me, it's more than just a location. It's a mindset. It's a diaspora that you should think you're a part of. But if we're talking about locality, what does that mean? And then how do we, those of us who've been professional, help the Black community? Because sometimes in our own culture, there's a split. You can go back into some of these communities and folks don't want to hear from you. So how do you bridge that when you're talking about providing for the Black community, or, giving access to these opportunities? Loaded question. I'm sorry, Howard, but you're the politician, so you handle it.
It is extremely loaded. It's extremely loaded, and we have to actually go back to mental health. But we continue to our community continues to fracture, is the best word that I can come up with. That we continue to fracture from traditional to what currently is contemporarily held concepts that are widely accepted. And so we're having to make this modification in our society. We are a people, just in general, we are a people that have nowhere to go. Now, we can talk about going back to Africa all day long, but that continent doesn't recognize us as its citizens. Everybody in this country can go places. They can go home, or they can bring that home to their community. We have actually carved out a nation inside of a nation. And because of that, the things that we use to help validate, for lack of a better word, our success are things from other races, and we haven't really truly thought about how do we value ourselves. We talk, at least I'm gonna say me, I'm gonna point the gun at me. We talk about Black Lives Matter, but at the end of the day, Black lives don't have value.
Mm.
And so they can matter and not have value. And there is no place in this country where Black people set value except with rims and tennis shoes. And so we need to figure out how we become part of the value equation in this nation. And the only way we do that is to actually, our communities need to come together. They need to bind together and we need to start acting as a collective community. And right now, again, that fracturing is taking our political and our social power away from us. And that's almost the best political answer I can give.
So I'm going to take it one.
Go ahead.
One step. The value that we have is an economic value. That's all. They see us. The only time value exists for Black people to a dominant culture is our economic value. That's it.
No, you hit on so many points, because there used to be a time when they didn't want to, when I say they, I mean the majority mainstream culture, didn't want to enfranchise us with certain luxury items, et cetera, because we would appear to be on their level. Now they don't care anymore, because you're going to spend all that money with them. And then if you get it taken away, they'll resell it again. So, you know, when you talk about that whole generational wealth and all that whole concept, I mean, you know, we're professionals. I bought a pair of shoes. When I buy a pair of shoes, I think about how they make me money. Will I put them on with my suit, whatever? I go into the Neiman Marcus, get a pair of shoes on sale. These kids are buying $1,000 Balenciaga sneaker boots. And I'm sitting there going, what are you doing? Different topic altogether. Right. But let me get to this one real quick. And it goes a little bit to what I just mentioned there. And we talk about mentorship. We talk about the community. I'm going to throw a hard one at you because, Gabriele, you answered this one about what are opportunities for women. Howard, what's the responsibility of Black men to lead in the healthcare space? I mean, we talk about, you know, there's still women that are on the rise in many fields, but there's still a lot of Black men who may have been there ahead of them that have some experience. What are we to do, having made that success, having had those experiences? What is the responsibility of Black men to help build that next generation of Black women and Black men in the healthcare field? Who's doing it today well, and how and what else can be done to make our presence felt so we can help lead this community again?
Dave, you like to set me up, don't you? Okay,
so that's my job.
I know. And this is an excellent question. So, in healthcare, anybody that's a casual observer of healthcare knows that it's a woman-dominated industry, for lack of a better word. But there are a bunch of men who sit at the top. Well, a bunch of white men that sit at the top of the organizational structures in healthcare. One of the things that we have to do collectively is not see each other as enemies in our navigating the healthcare space. I've seen in my career where my biggest obstacle in moving from one stage to the next is not somebody white, but somebody Black. And we need to figure out ways that we do this mentorship inside these organizations, that we ensure that we create a safe space for individuals to get knowledge and to move from level to level, and not be as predatory on each other as we are taught to be. And understand that teaching is intentional, and we need to be able to recognize when we're being held to a position to prey on our people versus praying for our people. And so our working together. So, and men have to understand that working for a woman is not a bad thing. You know, that doesn't mean that you haven't achieved where you needed to go. I've learned some of my best lessons from people who work in a space and have an experience set that I don't have. And we all can benefit from that. And men need to understand and know that it's not about less than. It's about we're trying to elevate our community as a team. It's not us versus you. not men versus women. It is us elevating our community collectively together.
We've only got a few minutes left before we close. I wanted to give each of you a final thought. Let me start with Gabrielle. What would you like to leave folks with when you think about healthcare, careers, the field, whatever you want to say to this audience?
I think it's key for us to elevate the voice of young people. We have someone on our team who represents young adult engagement. Every organization should have that, because it's a language that is spoken that necessarily our age we don't have. And how do we translate that into the work that we do? Also, we have to fix this generational split that women my age need to be more involved in the lives of younger women and helping them along, and understanding too that where they are right now, it's not necessarily that they're going in the wrong direction. How do we help them to have better insight on where they are? What are your goals? You know, how can we help you in those spaces? What can I bring to you? And I bring that to you as a volunteer. This cannot be something that we're going to financially benefit from. So we need to do more volunteerism to uplift younger women that may be struggling along, but do have a goal in mind, what they want.
Thank you. And before we close, and I will give Howard the last word, I just remind all of our guests, please go out to the booths as a part of this Juneteenth virtual fair, learn some things, talk to some of our partners, gain some more insight. And Howard, you have the final word.
Well, I first of all, let me just say I thank you all for this. This has been a tremendous opportunity for me and for Gabrielle and the HEAL Collaborative to be able to speak to some of these issues. Again, we are a family, and we need to start acting and working together to elevate our community as one. And my call to action to this team, to anybody that's listening to this, is that we need to start learning how to lock arms again, and saying that we shall overcome. We have not overcome, we shall overcome, but the way we do that is by locking arms together and attacking issues and concerns in our community together.
I want to thank you, Howard, and you, Gabrielle. I want to thank the audience for joining. My name is David Washington. I've had a great opportunity to be your moderator in this conversation. And as you can tell, we can keep going forever. So Gabrielle and Howard, I will definitely be looking you up when I'm in the Atlanta area, and we can do this over a live dinner and or lunch.
Yes.
So, thank you, everyone, for doing this. And Joel, appreciate your production. And I think that will end our session. Please go out to the booths and participate in the rest of our Juneteenth celebration weekend and career fair. And you all savor the moment. But as you said, don't just celebrate the holiday. Get out there and let's work. Let's make something happen. Have a great day.
Thank you.
All right.
Bye-bye.